Osteoporosis is an bone disease Look at this picture. Normal bone, osteoporosis bone. X-ray shows that introduction, detail going on. Osteoporosis is a common skeletal disorder characterized by reduced bone mass and deterioration of bone tissue, leading to increased bone fragility and susceptibility to fractures. It is often referred to as a silent disease because it typically progresses without symptoms until a fracture occurs. A definition: osteoporosis is defined by the World Health Organization as a bone mineral density that is 2.5 standard deviations or more below the mean peak bone mass of young healthy adults. It can be further classified based on the presence of fragility, fractures and BMD values. Types. First, primary osteoporosis, type 1. Post menopausal osteoporosis affects women after menopause due to decreased estrogen levels. Type 2 senile osteoporosis occur in both men and women over the age of 70 associated with aging. Second, secondary osteoporosis caused by underlying medical conditions or medications that affect bone metabolism, such as hyperthyroidism, rheumatoid arthritis, or long-term corticosteroid use. Causes: first, genetic factors, family history of osteoporosis. Second, hormonal changes, especially reduced estrogen in women post-menopause. 3. Nutritional deficiencies, low calcium and vitamin D intake. 4. Medical conditions, hyperthyroidism, diabetes, chronic kidney disease. 5. Medications, long-term use of corticosteroids, anticonvulsants, proton pump inhibitors. 6 lifestyle factors: sedentary lifestyle, smoking, excessive alcohol consumption. Risk factors: 1. Age, risk increase with age. 2. Gender, higher prevalence in women, especially post-menopausal women. 3. Body frame size, small, thin individuals are at greater risk. 4. Race, Caucasian and Asian descent have higher risk. 5. Family history, genetic predisposition. 6. Diet, poor nutrition, especially low calcium and vitamin D. 7. Physical inactivity, lack of weight bearing, exercise, etc. 8. Lifestyle choices, smoking, excessive alcohol use. 9. Medical history, conditions and medications that affect bone health. Complications: first, fractures, commonly in the hip, spine and wrist. Second, chronic pain, persistent pain due to fractures. 3. Deformity, spinal fractures can lead to hyposis. 4. Disability, reduced mobility and independence. 5. Mortality, increased risk of death following hip fractures. Pathophysiology, osteoporosis involves an imbalance between bone resorption by osteoclasts and bone formation by osteoplasts. This imbalance leads to forts and brittle bones. Factors such as hormonal changes, nutritional deficiencies, and reduced physical activity contribute to this process by affecting the bone remodeling cycle. Signs and symptoms: early stage, often asymptomatic. Advanced stage, fracture with minimal trauma, back pain due to vertebral fractures, loss of height over time, deformed posture. Medical diagnosis: 1. Bone mineral density BMD test, dual energy X-ray, abstometry scan is the gold standard. 2. Clinical evaluation, patient history, risk factor assessment. 3. Laboratory test to rule out secondary causes, example calcium, vitamin D, thyroid function test. Nursing diagnosis: 1. Impaired physical mobility related to pain and fractures. Second, chronic pain related to bone fracture and deformities. 3. Risk for injury related to bone fragility. 4. Imbalanced nutrition less than body requirement related to inadequate intake of calcium and vitamin D. 5. Activity intolerance related to pain and reduced physical endurance. Management and treatment: 1. Lifestyle modification. Diet: ensure adequate intake of calcium and vitamin D. Exercise: weight bearing and muscle strengthening exercises. Lifestyle: quit smoking and limit alcohol. Pharmacological treatment: bisphosphonates, selective estrogen receptor modulators, hormone replacement therapy (HRT). For post-menopause women, calcitonin for pain relief in acute vertebral fractures, parathyroid hormone analogues, rank ligand inhibitors. Then 3 non-pharmacological interventions, mainly full prevention, home safety assessment, balance training. Then psychosocial aspects should be think: 1. Emotional support, counseling for depression or anxiety related to chronic illness. Second, support groups, connection with others facing similar challenges. 3. Education, information on disease management and lifestyle modifications. Prevention: 1. Healthy diet rich in calcium and vitamin D. 2. Regular exercise, weight bearing and strength training activities. 3. Avoid smoking and excessive alcohol, reduce risk of fractures. 4. Bone density test, early screening for at-risk populations. 5. Medications, preventive medications for high-risk individuals. Conclusion: osteoporosis is a major public health concern due to its prevalence and impact on quality of life. Early detection, lifestyle modification, and appropriate treatment can significantly reduce the risk of fractures and associated complications. Comprehensive management involves a multidisciplinary approach including medical, nutritional, mainly psychosocial aspect of interventions to improve outcomes for individuals with osteoporosis. Thank you. Have a nice day.